What is coenzyme Q10? Coenzymes are molecules essential in obtaining energy from food. They are believed to delay aging and are used in treating several diseases. Our body synthesizes coenzyme Q10 naturally when we eat red meats, soy, canola, and sesame seeds. However, our capacity to produce coenzyme Q10 diminishes throughout the years. And since our general health depends on the levels of this enzyme, its ingestion through nutritional supplements is highly recommended. Properties. Coenzyme Q10 helps cells burn oxygen in order to provide ATP, the molecule of life, that gives them enough energy to achieve their vital functions. In this chain reaction of cellular energy, coenzyme Q10 becomes an outstanding antioxidant. Benefits. Coenzyme Q10 delays aging by allowing reproduction of cells implied in skin rejuvenation. Thanks to its antioxidant traits, it increases life expectancy. Since daily ingestion of coenzyme Q10 improves metabolism, we finally can lose weight the natural way. Also, by reducing bacterial plaque, it prevents and cures periodontal disease. Studies prove that coenzyme Q10 helps in cardiovascular diseases like chest angina and arrhythmias by keeping blood pressure in adequate levels and reducing the risk of heart attacks. Coenzyme Q10 may stimulate the immunological system, naturally strengthening our body's defenses.
On how you can best utilize coenzyme Q10, also known as CoQ10, to naturally help lower your cholesterol and triglycerides and give you a healthier heart. I'll quickly go over some reviews about this ingredient, then we'll talk about some facts, myths, and important health warnings as well. And just to let you know, I'm doing this just because I get emails every day and there's so much confusion and misinformation online about this ingredient and many ingredients, and my goal is to help with this video to help reduce your confusion and give you some clarity. Now, the very first question I get is, how effective is CoQ10 for lowering cholesterol? Does it even work? And yes, it does work. In fact, every cell in the human body requires CoQ10. Without it, you would die. And most specifically, your muscles need CoQ10, and most abundantly, the greatest requirement, the highest concentration of CoQ10 is in the heart muscle. In fact, reducing CoQ10 in your body will increase the factor of heart disease many, many times. And this is one reason you do not want to take statin prescription drugs, because these are the #1 depletion of CoQ10. And that's the irony. Doctors will prescribe statin drugs to help with your heart, and yet these drugs cause more damage to the heart. So you want to just stay away from them, or at least supplement CoQ10 with them, and I'll get to that in a second. Now, one question I also get is, can CoQ10 help reverse heart disease? And yes, it can. And as mentioned, every cell in the body needs it, especially your heart. But the reason that you want to supplement your diet with CoQ10 is because naturally your body makes it, and the natural production of CoQ10 peaks in your 20s and then declines thereafter. So you want to add it to your diet, because unfortunately the main source of CoQ10 in food is organ meats, such as liver and brain. And in modern society, especially in America, that's just not a part of the diet. So many people, middle-aged and onward, are deficient, and hence again why you want to supplement and add CoQ10 to your diet. So now let's move on to warnings and potential scams. So as with anything, there's always a potential negatives, and there's something you got to watch out for even with CoQ10. First is, if you are taking a statin prescription drug, such as Lipitor, Zocor, Crestor, you must, okay, you must supplement your diet with a with CoQ10 pill, because these harmful drugs deplete this vital enzyme, which ironically, you know, as I stated, they're prescribed to help with your heart, but they cause more problems. And you want to take a minimum of 100 to 200 milligrams of CoQ10 if you are taking these prescription drugs. There's two different forms, but one of the best forms of CoQ10 is known as ubidequinone, and it's better because it's more absorbable when it's a natural form. So that's the one thing you want to focus on. And also, you never want to take only CoQ10 by itself, because it doesn't lower cholesterol levels. It doesn't improve your LDL, HDL. Now, it's needed for your healthy heart function and muscles. That's why you want to take it, but you want to do so with other ingredients. So at this point, someone says, all right, so what's the best solution? What's the safest solution? The drugs are going to cause me problems, and you're telling me not to take CoQ10 by itself. So I'll be honest, there is no one ingredient that works 100% effective forever, let alone for every single person. And this includes CoQ10 or any single herb or nutrient. Just think about it. You don't just only eat broccoli for the best health, right? You mix it with other vegetables and other fruits, and that's what creates a more balanced diet and a better health. So the best products that you want to buy, that you want to purchase, that you want to use, they use CoQ10 in conjunction with other key ingredients. And thanks for listening. Stay happy and healthy, and have a fantastic day.
CoQ10 is a nutrient that has become very popular. In fact, I have a lot of patients who ask me whether they should be taking it and how much they should be taking it. Does it help in heart conditions? Does it help with vitality and energy levels? So therefore, today, me, Dr. Ray Sahilian, I'm going to talk about the benefits and side effects and the potential medical uses of this very interesting nutrient. CoQ10 is short for coenzyme Q10. It has been discovered in 1957 at the University of Wisconsin and has been used since that time as a supplement for a number of conditions. Every cell in the body needs energy, and so every cell in the body breaks up sugars, fats, amino acids. And this is done, the metabolism of this is done in little enclosures in cells called mitochondria. And CoQ10 is very important in mitochondria. It helps in the electron transfer within the cells of the mitochondria, and CoQ10 helps in the formation of ATP, adenosine triphosphate, and it's a very important energy source in mitochondria and in the cells. Unfortunately, if you're a vegetarian, you're not going to be getting that much CoQ10, because this nutrient is mostly found in meats and fish, and maybe a little bit in nuts. Most people will have an intake of about 2 to 5 milligrams of CoQ10 a day. So therefore, if you're a vegetarian and you're not getting enough, you may need to take a supplement. There's been quite a number of studies with CoQ10 in humans, and most of the studies have focused on its effect on heart failure and using CoQ10 after a heart attack, for people who have high cholesterol, for people who have hypertension or diabetes. Let's focus on heart attacks. There have been a few small studies where CoQ10, when given as a supplement for people who had a heart attack for a few weeks or a few months or a year afterwards, did show improvement in clinical outcomes. There's also been studies in giving CoQ10 for people with heart failure. And again, the studies have been small, but most of them have shown that there has been clinical outcome improvement when people have been given CoQ10 supplements for heart failure. As far as hypertension, perhaps CoQ10 can lower blood pressure a little bit, but certainly it's not going to be as effective as other nutrients or blood pressure lowering medications. Now, I believe CoQ10 has a very important role to play in people who are taking cholesterol medications. If you have high cholesterol, most likely your doctor will prescribe to you statin drugs. For instance, some of the product names include Lipitor or Zocor. These drugs do help lower cholesterol levels, but unfortunately, they also lower CoQ10 levels. So if you are taking statin drugs, talk to your doctor and ask him or her whether you should be taking CoQ10 as a supplement to replace the loss that the statin drugs are causing. Now, before you take CoQ10, you should know that it does have some side effects, nothing really serious. No major side effects have been found with this nutrient, but some of the things you should watch out for include, if you take too high a dosage of CoQ10, you might feel fatigued, restless, and have insomnia. If you're too restless and anxious and you're not sleeping well at night, the next day you're going to be tired. So even though CoQ10 helps increase your energy levels, if you take too much, it's going to be counterproductive. The conditions that CoQ10 will be helpful for include heart disease, heart failure, maybe hypertension, maybe in diabetics, since it can help improve endothelial function. But mostly CoQ10 is going to be helpful in increasing energy levels for people who have fatigue, particularly fatigue if you've been working out a lot or have a lot of physical endurance, if you're doing a lot of physical activity. I'm very hopeful that in the near future and in the next few years there's going to be a lot of studies with CoQ10, and we're going to find out that this antioxidant nutrient is going to have an incredible amount of potential in being useful either in treating or preventing a number of medical conditions.